So again, when we talk of healthy heart, we always want certain few activities or the points to be noted. First and foremost thing would be probably regular exercise. We all know because of the lockdowns and because of the risk of infection, we are not stepping out of our houses. And so whatever daily exercises, the routine, the physical activities have gone down significantly. So we have to ensure that whenever we are at home, we are regularly doing alternative form of exercises so as to keep ourselves healthy. Now, whenever we have a patient with heart disease, or for that matter, every individual, our aim is to do physical activity of moderate severity or vigorousness for 30 minutes a day, at least 5 days a week. Now, when I say 30 minutes exercise, our aim is to maintain heart rate above 120 for these 30 minutes, and we have to ensure that we are doing it daily, at least 5 days a week. Now, the form of exercise can be walking on a treadmill or using an exercise bicycle, doing yoga, pranayam, or some other form of exercise that is feasible at home or in our surrounding. Even if we don't have all these machineries available, even walking or jogging over the terrace or in our courtyard would suffice. But we have to see to it that we do our exercises daily. See to it not only in the morning, throughout the day, we keep on walking every after hour or two so as to burn sufficient calories and avoid weight gain. Now, second important point would be, as I had highlighted, to take medicines properly. It's not like if my blood pressure is fine, my sugars are fine, I'll be lenient about the medications. If we take all the prescribed medicines properly, probably BP and sugar would be controlled. We have to monitor our weight regularly. Now, in lockdowns and decreased activity, we tend to have more junk food and frequent small meals and decrease in the activities that can lead to weight gain. So we have to see to it we are avoiding that. Diet is very, very important. Whether we are at home or at our work, we have to take care that we are taking proper diet. As we all know, in heart disease patients, we avoid high caloric diet, we avoid fatty substances, we avoid too much of salts and too much of sweets. So we have to take care. Even during these lockdowns, we continue with the same dietary restrictions and restrict salt and even fluid intake if it has been advised. There is a lot of discussion about maintaining good hydration. See, when we say good hydration, that doesn't mean we keep on drinking water 24/7. We have to see how much water and fluids we are taking in. If a patient has got old myocardial infarction or history of heart attack, if patient is known to have weak heart, by weak heart I mean the pumping power of heart is low as compared to normal. In such patients, if there is overhydration, if there is excess of fluid consumption, that can be very harmful. So we have to measure the fluids, and if at all any doubt, you can contact your doctor and ask him what is the ideal fluid intake that it is recommended. Normally, if a patient has got weak heart, we do recommend the total fluid intake, inclusive of all the liquids that we are consuming, should not cross 2 liters in summer and 1.5 liters in winters. So we have to take care about the amount of fluid that is being taken in 24 hours, and accordingly things should be monitored. So if we take into consideration these small steps, probably we'll be able to keep our heart healthy during this phase. One more important thing which is neglected is mental stress. We all know with a lot of discussion about COVID, a lot of negative news, those are coming up. If you open up our news channels, if you look into your mobiles, in WhatsApp and messages everywhere, there is discussion about the pandemic, COVID pandemic, the health hazards it is causing, the mortality it is causing, the financial losses, and there's a lot of stress. So we have to see to it that we keep ourselves calm. There has to be some mental relaxation activity in the form of yoga, meditation, music, or any other hobbies that we can inculcate and follow during this period, so as to keep ourselves calm and avoid the mental stress which can lead to increase in the blood pressure, increase in the sugars, and can precipitate a heart attack.